We're talking hormones and how they affect our moods and our sex life, and even how they can affect our appearance. Well, joining us now is good friend to the show, Dr. Sonia Batra. Dr. Batra, thanks for joining us.
Thank you so much for having me. Nice to see you both.
Yeah.
Dr. B, so nice to see you.
So we're
Great
hearing
to see
this
you.
term, and it's a new term. It's called menopause face. First of all, it sounds really awful, just to start that way. But explain to the audience, what is menopause face?
Sure. So yes, this is a real thing. And when we talk about menopause, we're talking about the decline in estrogen and progesterone in women. And so unfortunately, this does take a toll on your appearance. What happens is we all start to notice thinning of the skin, more dry skin, fine lines, crepiness, wrinkles, the sad sagging that starts to occur along the jawline due to lack of elasticity. So all of that kind of falls together as that menopause face. It can also even go along with hair loss and acne breakouts. There's a whole constellation that comes with those hormonal changes.
What are the main issues that you see and hear from your patients when it comes to menopause face?
Well, I think first and foremost, women notice that their skin becomes thinner. And then alongside that thinning, you start to notice fine lines and wrinkles. Many of us notice that our skin becomes drier because that estrogen premenopausally is so important in maintaining the hydration of the skin. And then unfortunately, women often don't realize, well, we always think about male pattern balding. Women also do get thinning of the hair, and many times it's accentuated after menopause.
Is it thinning or is it actual hair loss?
Well, it's both. So many times because our skin or our hair, I should say, becomes more dry and fragile, it starts to break. It becomes much more sort of dry and hard to style. So that's one thing women notice. But then the second thing is because of the decrease in estrogen, you get a relative androgen dominance, which is the testosterone, the DHEAS, those sort of classic male hormones that we associate with male pattern baldness. In women, it looks a little bit different because you'll often have the hairline preserved, but then you get this thinning on the front part of the scalp that many women will see as a widening of their part, or they're going to see much more of their scalp visible when they look from the front. And so it's really frustrating because it is due to those hormones, but there are things you can do to help it. First and foremost, over the counter, there's minoxidil, which has been available without a prescription for years. And for women, I typically recommend starting at 2% because you can actually massage it into the skin of the scalp and it's going to improve circulation to the follicles. If you are at all concerned about the texture of the hair, we often talk about iron supplements. We talk about a vitamin B called biotin, which you can take 2.5 milligrams, which is 2,500 micrograms a day. And another thing that women often don't think about, especially around menopause, is sometimes hair loss can be due to thyroid fluctuation.
Sure.
So you should always get your thyroid count as well. If it's really problematic, definitely go in, see a dermatologist or a plastic surgeon because we also have lasers, we have PRP, we have treatments in the office we can do for thinning hair and hair loss that can certainly up the ante as well.
Yes. And also, the next on your list, and I'd like Drew, I want you to weigh in on this also, wrinkles. I mean, wrinkles are a fact of aging for everybody.
We all lose 1 to 2% of collagen per year starting at age 30. And so as you lose that scaffolding, and then in women, you lose the estrogen, so the skin becomes thinner and much more crepey, you start to see those accordion pleats. And I'm sure it's a common issue that Dr. Orton sees in his practice as well.
Oh yeah, all of the above, exactly what you're saying. And interesting enough that the pattern is different in men. Men age a little bit differently in the wrinkle issue in men. Part of the reason is we're shaving all the time, which is a form of dermaplaning, dermabrasion, if you will, that I think keeps some of those wrinkles at bay. Men and women a little bit different, but some of the aging changes are the same.
So Dr. Orton talked about exfoliating the skin with dermaplaning, and for women, many of us will use chemical exfoliants. Two of my favorites are retinoids like tretinoin or Retin-A, which will help stimulate cell turnover. They're going to stimulate collagen. And those come as both over-the-counter and prescription strengths. And then there are also alpha hydroxy acids, which are things like glycolic acid, lactic acid, similarly exfoliating, going to help promote that collagen that we're all losing and help as well just with the cell turnover that will decrease breakouts, congestion, and clogging.